lot of patients have tried a lot of different things by themselves because they don't want to come forward and elicit that there is actually a problem. So the first thing that you can do is mention it to your MS nurse, your physiotherapist, your occupational therapist, that you do have a problem, because there's so many resources out there now to help bladder and bowel dysfunction. Most areas have community bladder and bowel services that patients can be referred into, and a lot of them have self-referrals as well. So the next step would be to have a proper assessment of your needs and find out what I can do to manage my bladder and bowel problem, whether or not there's different equipment that might be useful to manage it. Do I need a medication to manage it, particularly with bladder problems? An overactive bladder, which is where you go to the loo frequently, so more than 8 voids a day usually. You get urgency and frequency, and you quite often get up quite a few times overnight. So there is medication that can help that once lifestyle changes and pelvic floor exercises and bladder retraining has taken place. So the good starting point is to have a proper assessment, and then you'll be given different ways to manage whatever continence problem, what bladder and bowel problem you have. So I'll go through a couple of urinals which are on prescription, and your community bladder and bowel nurses, your MS nurse might already have information about these. Occupational therapists and physios can be aware of these items too. So one of the first things I'm going to show you is a urine director. Urine directors are really good for gentlemen that may have a problem with after dribble or flow issues. So quite often as a male will age, the prostate gets bigger. It causes problems with the passing urine, where you can have a slow flow, you can have a stop-start flow, some hesitancy. They can all be signs of the prostate being enlarged. So a non-spill, a urine director will go over the front of the penis, and you can direct the flow into the toilet to reduce spillages and leakages onto underwear and things like that. They're quite good because they can also sit in a urinal, and one of the urinals like this, they can sit within there. So you've then got a little bit extra room in order for that urine to go into the urinal. And the good thing with this urinal is that it actually comes with a T-tap, so you can put a night bag onto it or a day bag, which is a catheter bag, and then you can use that overnight instead of the risk of getting out of bed and falling. The urinal with the T-tap is really great for patients with functional issues, that because we know that getting up frequently at night really impacts on fatigue levels. There's a high risk of falls, you're at higher risk of breaking a hip from falling at night, and it's one of the main admissions to A&E services is falls due to noxuria, that's getting up at night to pass urine. So that's another one that's available on prescription. It comes with or without a T-tap, and you need a catheter bag to utilise that. So with the urine directors, the different sizes can be quite useful for gentlemen with penile retraction, because penile retraction can be an issue for some gentlemen. By utilising a non-spill adapter, we can actually get a little bit more length on the penis, which gives us a little bit more for direction into the toilet. So the non-spill adapters are really great pieces of equipment that are available on prescription. This one is a female urinal. So you need a little bit of a dexterity and a little bit of upper body strength to be able to slide that in between the legs and get it into the right position at bed at night. But it's great for patients that, again, with functional issues, you struggle to get up to the toilet at night. You can put a night bag onto the end of the T-tap there, and that could be used frequently throughout the night instead of having to get up and go to the loo. It can be great for wheelchair users as well. So it's really versatile, and one of the better female urinals out there for ladies to try and utilise. Really lightweight, and with all of the urinals and equipment, it just gets washed in warm soapy water and left to air dry. The last thing I want to show you is something called anal plugs, and I think fecal incontinence and bowel dysfunction is one of the areas that a lot of patients really get embarrassed about talking about. A lot of patients will come forward and talk about bladder dysfunction more likely than bowels, but bowels are one of those taboo subjects that something big has to happen before someone comes forward and asks for help. And that could be an accident when out shopping. It could stop you from doing something that you really want to do. You could have a really horrible wound which isn't healing, and we have to think what we're going to do to manage the problem. So with all bladder or bowel problems, assessment is key, making sure you get the right assessment, because most bladder and bowel issues can be improved. It can improve your quality of life, and quite a lot of bladder and bowel issues can also be cured. But with the correct assessment, if we've got a patient with fecal incontinence or fecal smearing, fecal urgency with leakage, then an anal plug is something to think about, to utilise to stop any leakage occurring. So this is an anal plug which is just sitting in the rectum there. What we do is pull the white applicator out, and then that's what the anal plug looks like in the rectum. So you could go out shopping, you could go on long journeys, you could use this if you've got, like I say, for wound care purposes, end of life purposes, anything, as long as you've been assessed and there's no contraindications to using an anal plug, then anal plugs can be used for up to 12 hours a day. You would take them out, obviously, if you wanted to open your bowels, and then you could have a new anal plug inserted. So the once only insertion of the anal plug, if I remove it, that's what it looks like. It's made of a medical silicone, and it's just got a little bulb in there of non-toxic filler to hold it in place. It comes in small and large, and usually we give patients samples to try first and see what they feel is comfortable. So it would go into the rectum, you would remove the applicator, and it would stay in place like that. The other thing I want to show you is a Renew insert. Renew inserts have been around for quite a long time. Again, it's good for fecal leakage. I would say for an insert this side, with my experience, I would use this for someone with small amounts of leakage. If you've got a stool that's a little bit formed, a little bit mushy, which we would call a type 6 on the Bristol stool chart, a 5 to 6, this would probably be more beneficial for that. If you had a lot of liquid stool, it would quite often easily dislodge. So again, we pop a little bit of lubrication on and push it into the rectum. We would remove the applicator, and we'd be left with a little, obviously the little silicone area outside there. Great for accidental bowel leakage, available on prescription. So the list's not exhaustive. There is lots of different aids out there which, with the correct assessment, you can find out what's suitable for you, and what suits one person may not suit another person, and it has to be patient choice, it has to be included in that, and you have to think about what's going to suit your needs the most. If patients feel comfortable in speaking to their MS nurse, the OT physio, whichever healthcare professional is involved in that patient's care, we as healthcare professionals should have that knowledge to be able to ask those questions. So within my service, we send out a questionnaire to patients, and the patients choose the top 3 things they want to discuss in clinic. I would say 70 to 80% of the time, bladder and bowel's already on that questionnaire as ticked as being an issue they want to discuss. So it opens up that conversation to say, you've mentioned this on your questionnaire, tell us a little bit about what's happening. But you have to have the confidence to be able to ask the question and know what to do with the information that's given to you. So I would say, don't be scared to ask your health professional. If you have got a bladder or bowel problem, they might not have the experience to manage whatever issues occurring, but they will be aware of which services will be more beneficial to meet your needs. And particularly if you're having unusual symptoms like blood in the stool, blood in the urine, pain in the loin area, so around the back of your back where your kidneys are, repeated urinary tract infections, unexplained weight loss. They're all different symptoms that need a healthcare professional to look into further. So don't be afraid to go to your doctors and ask for those, for that assessment to take place, because we want to make sure that there's nothing sinister going on that we need to deal with first before we go into further assessment of your bladder and bowel needs.